Good morning, everybody. My name is Sara Kenyon, and I'm going to talk to you about the vulnerabilities that we identified in the Asian, white, and black women who were part of this confidential inquiry. The first vulnerability was around citizenship and ethnicity. You can see here that the citizenship was not well recorded, and we found inaccurate and inconsistent recording of both citizenship and ethnicity. In fact, nearly half the Asian and half the black women did not have their citizenship recorded. The definitions of citizenship and ethnicity are important if we're to understand how to record them. And citizenship refers to the legal citizenship status of a person. It can be by birth or naturalization, and a person may have more than one citizenship. Their ethnicity is the group or the membership of a particular racial, national, or cultural group in the observance of that group's customs, beliefs, and language. And we found both of these inconsistently and inaccurately recorded. So our recommendation is to develop national guidance and training for all health professionals to ensure accurate recording of women and their partners' self-reported ethnicity and nationality and citizenship status so you can provide personalised care. So you can make a difference. Start now. The women that you're looking after, look back at their notes. Make sure that the nationality, the citizenship, and the ethnicity is recorded of the women that you're looking after. It's so important. One of the main vulnerabilities that we identified as part of this confidential inquiry was around language needs. Now, the identification of language needs and interpreter provision was not very good. For 13 Asian women, 12 black women, and 4 white women, their first language was not English. 10 Asian, 4 black, and 2 white had difficulty in speaking or reading English, and 9 Asian and 4 and 2 black and white women required an interpreter. Of those women, none of them had interpreter provision throughout their care pathway. Now, can you imagine anything more scary than being in a situation and these women lost their babies and not being able to understand what was happening? We need to do better. So 5 Asian Pakistani, 2 Asian Indian, and 2 Asian other, 1 Syrian and 1 Iraqi, 4 black African and 2 white Eastern European women didn't have required an interpreter, and at some point didn't have one. We also identified language needs for an additional 3 Asian and 2 black women. And we found this because while at the booking appointment, interpreter needs were not identified, as their care progressed, an interpreter was provided, which is good, but we need to get better at making sure we understand a woman's language and interpreter needs. I'm just going to leave you to read this vignette. So not only does this case show, or this woman's care show, the lack of interpreter needs at the 29-week emergency referral to triage and at her subsequent routine care, but also that she didn't understand the process. So when she didn't make her appointment, she wasn't part of the DNA process, and how would she know when to come next? It's so important. So our recommendation is for maternity staff to be provided with guidance and training to ensure the accurate identification and recording of language needs to support personalised care. This should include guidance about when it's appropriate to use healthcare professionals as interpreters, because sometimes it isn't. You can make a difference. Start now. The second recommendation is to provide national support to help identify and overcome the barriers to local equitable provision of interpreter services at all stages of, of perinatal care. And this has to include resources to provide written information and individual parent follow-up languages, letters in languages other than English. Now you can start straight away. If you find somebody who needs an interpreter and the provision isn't, you either can't get one or they don't come, or a situation means there isn't anyone available, report that, because then it will become noticed and it's so important. Another vulnerability that we identified was around social risk factors and their recording. So we identified social risk factors using a slightly enlarged list. This is developed by the Revolving Doors Partnership in 2019. You can see the list here. And you can see that within this group of women, the white women had many more social risk factors than the Asian or Black. But what we found was inconsistent recording of these social risk factors within the notes, sometimes standardized, sometimes random. And these things are really important. Women need additional support if any of these are present. And how can we provide that if we don't ask or we don't know? So this is a vignette which shows poor multidisciplinary team working. Routine mental health assessments are so important. We know that perinatal mental health is a really big issue for a lot of women. And we found the woolly questions or other means were not the routine questioning was evidenced less frequently in Black women. There were 10 of them, we couldn't find it, compared to 6 white and 5 Asian. And overall, in the postnatal period, there were fewer assessments for all groups of women. Now, it's so important. We know that perinatal mental health really affects not only the women, but the development of their babies. So we need to make sure we ask routinely how women are and refer them if we think there's a problem. So increased social risk factors, as I said, were predominant vulnerability within the white women. But is there under-recording of social risk factors within the Asian and Black women, particularly as we've identified within this group language and interpreter needs? And if the social risk factors are not recorded systematically within maternity notes, we are going to be missing some. So our recommendation is to develop a UK-wide specification for identifying and recording the number and nature of the social risk factors, and not just asking at booking, because things change for these women. And it's really important that we know that and try to provide enhanced support and referral in a personalised way. Now you can start now. Try to ask the women that you're looking after if they have any of these social risk factors and then offer them support. We also looked at engagement and access as part of the confidential inquiry. We looked at engagement by looking at the timing of booking, the accepting of routine screening, and whether women were followed up following DNAs. While late booking at 13 weeks or later was similar between the groups, routine combined screening was declined by 11 Asian, 3 Black and 2 white women. The follow-up of women who did not attend their appointments, we had 4 Black women, 4 Asian and 2 white who didn't attend 2 or more appointments. While the majority of DNAs were followed up, we're usually very rigorous about that. There were examples when the reasons were not explored in any detail and there was a lack of personalised response. This is a long vignette, but I think it makes a very good point. So if the women you're looking after have a lot of appointments in different places, really think about how you can streamline those appointments and make sure she can attend them. We also found barriers to accessing specific aspects of care. And the ones we looked at were self-discharge, taking your discharge against medical advice, not taking medication, and non-attendance at specialised appointments. And these barriers we identified particularly in Black women. There were a total of of 9 Black women, 6 Black African, 2 Black Caribbean, and 1 Black other, and 1 Asian Pakistani and 4 white women who for some reason didn't access specific aspects of the care we were offering to them. Clearly, this is really important, and we need to understand why this is happening and provide additional support for these women. Here's a vignette which really shows a lack of sensitivity, potentially resulting in poor engagement with maternity services. And this lady had a total of 25 antenatal appointments. I'm not surprised she didn't attend 10 of them. My goodness me. So, a lack of personalised support. So, our recommendation is to ensure maternity services deliver personalised care. And we need to identify and address and understand the barriers as to why this is happening, particularly within the Black women. And you can make a start right now. Try to talk to the women that you are looking after and understand their individual needs. You can make the difference. So these are the vulnerabilities that we have found as part of the confidential inquiry in all these women, but particularly poignant within the Asian and the Black women that we saw. I'd like to particularly thank the people listed who supported in writing this chapter. And while we make recommendations to improve the situation, your care and your support for these women is so important. Start now. Thank you.